Hi, this is Dr. Gary Lee at Elevation Health. I wanted to share with you the miracles that we're seeing here with the treatment of scoliosis. Come on in. Welcome to Elevation Health. This is Dr. Gary Lee. I want to go over a case of a young woman in her early 20s who had kind of lost hope that she was going to have any help with her scoliosis. And certainly she's becoming surgical, as you can see in this x-ray. You have to remember that anytime you hit 45 to 50 degrees, surgery is indicated. And so here we're looking at a curvature of 47 degrees in her low back. And this is difficult because it's quite severe and certainly very close to needing surgery. So we went ahead and ordered a scoli brace, and this is just a 30-day follow-up x-ray to see how this patient is doing. You can see just visually there's a significant difference between the initial x-ray and the follow-up x-ray. The initial measured 47 degrees, the follow-up measures only 17 degrees, okay? And so this, of course, is in the brace, and now we need to allow some time for additional adaptation. But these are the kinds of changes that we're after, and certainly the kind of change that you don't see with other types of scoliosis treatment. And this is what we do to avoid surgery in cases of scoliosis. So let's go ahead and take a look at another case. So this case is a young girl in her early teens, and that's usually where we start to see scoliosis appear. You have to remember that 95% of scoliosis occurs in girls, only 4 or 5% in boys. And so with the girls, from about the first date of their first period, they're going to start their rapid growth, and that's where we usually start to see the significant deformity in the spine. And so this young girl came to us. This is her initial x-ray at 27 degrees. That's a pretty good curvature in there, and she's just started to grow, and she's got another 1.5 to 2 years of rapid growth to go, so this obviously could continue to increase. And so because she lives out of state, we had her come in at a 2-week follow-up to see how she was doing, and this is her 2-week follow-up. And look at the significant difference between the initial at 27 degrees and a 2-week follow-up at 9 degrees. Now, I want to point this out. This is without the brace. This is wearing the brace. Now, this is enough time for her to adapt and begin to fit the brace, but it is not enough time for full adaptation yet. And so we need to give her some growth time now. This will probably decrease a little bit more, but what we're going to start to see is less rotation in these vertebrae, indicating that the bone is now beginning to grow normal, and that is a permanent change for her. So now I'd like to look at the upper back, because this girl does have a double curvature. She has a curvature in one direction in the low back and another curvature in the upper back in the opposite direction. So let's take a look at those x-rays as well. So here we're looking at the upper back or the thoracic spine, and we see a curvature, and you can see part of the lumbar. That was that original curvature we looked at, and here is the upper back or the secondary curvature. And again, we have some very significant rotation up through here, and then we've got the ribs. We have the rib cage, which adds a lot of stability to the thoracic spine, but it also makes it more difficult to change. And so here she's at 34 degrees, and we did, again, that 2-week follow-up. We went ahead and took x-rays there, and here she is, and it went from 34 degrees down to 17 degrees. So we had about a 66% improvement in the curvature in the low back. In the upper back, we have about a 50% curvature in just 2 weeks. Now, again, I want to point out, rotation, when we see these little white marks here, these are the spinous processes. They're attachment site for muscle on the back. These should be in the middle of the vertebra. This would be considered normal, but you can see how they rotate way off to the side in the original, and you can see where here we have less rotation. They're starting to move back towards the middle. And that's what we want to see. That indicates that we have a difference in bone growth, and as she improves, we'll see those move closer and closer to the center, indicating that the bone is not wedged anymore, that it has grown more towards a more block or square type of a vertebra. That's what we're after with growth in children, and that is correction of scoliosis. So if you have any questions, if you have a child, a friend has a child, if you know someone who is even an adult with scoliosis, we can correct that. This is probably the third and fourth case that I've shared with you on correction of scoliosis, and these are the kinds of the changes that we are seeing consistently with the use of this bracing system. So give us a call here at Elevation Health, 801-974-5555. Don't let this continue. If you have a child that's in the early teens, that is the time to get the most correction and avoid surgical procedures down the road. So give us a call. Again, 801-974-5555. I'll see you soon.